Well, thank you both very much for joining me. The purpose for this webinar is for the three of us to get together and have some thoughtful considerations around arthritis. As we all know, there were 23% of all Americans, adult Americans, are having arthritis or living with arthritis. And that comes to about 54 million people in the United States. What we wanted to do today is we wanted to have a discussion around some of the questions and some of the concerns that folks that have arthritis have in this world with COVID-19. Obviously, many states are beginning their, are getting away from their stay in place. And so a lot of people in all of our communities are curious about, what should they do? How should they engage their medical provider? If they're on a particular set of treatments, what do they need to ask their treatment provider? And so hopefully we can address some of these considerations and talk about some of this stuff. With me today, I have Dr. Craig Carson of the Oklahoma Arthritis Center. Dr. Carson is the founder of the Oklahoma Arthritis Center, board certified in internal medicine and rheumatology. He's also the chief medical officer of Pure Infusion Suites and is a member of the American Academy of Pain Management, American College of Rheumatology, and the American Medical Association. So thank you very much for joining us, Dr. Carson.
Thank you very much.
Also, I have Rebecca Gillette with me. Rebecca is the health strategist for the Arthritis Foundation. And my name is Josh Smith, and I am the Chief Growth and Strategy Officer for Pure Infusion Suites. And I'm also on the advisory committee for the National Infusion Center Association. So just to begin, a couple of areas that we wanted to touch on today is, one, we wanted to talk about communication. Obviously, there is a lot of information going around from good sources like the CDC, not so good sources like some of the news outlets. And so we want to make sure that we have clear lines of communication on considerations that people that have or are living with arthritis, that they have as it relates to their arthritis care. So Dr. Carson, I'd like to start with you. One of the things that is difficult for folks with arthritis or anybody that's engaging in medical care today are, what are the considerations or the questions they need to be asking their medical provider around when it's appropriate for them to go back into an office for non-coronavirus issues?
That's a good question, and I'm not sure there's an exact answer. We've been doing a lot of telehealth the last few weeks, and I'm grateful for that. I'm grateful to maintain some connection with patients, but there's just nothing like seeing a patient face to face and being able to look at the joints and troubleshoot together on what the best treatment approach might be. I think as everybody gets a little more comfortable with the fact that this virus is going to be with us, then I think we'll become more comfortable going back to normal activities like seeing your doctor or going to the grocery store or whatever we need to do in life. There's some things you just can't take care of over the phone. So I'm actually looking forward to getting back to being able to see patients in person and take care of them.
I totally agree. I think that the face-to-face, in-person communication around any medical issue is really important. But in lieu of the fact that right now, as you mentioned, telemedicine is becoming extremely popular because of the stay-in-place orders, and people still have medical considerations that they need to have dealt with. What are some of the best ways for a patient to communicate how they're feeling, what they're dealing with as it relates to their arthritis?
You mean the best way to you mean like in person or over the phone, or what are the
over the phone or through a video conference, obviously, if they can't come into the office itself?
Video conferencing works amazingly well. It's still not like the face-to-face visit, but it does work, and it has allowed us to take care of patients through this difficult time.
Mm-hmm. Yeah. Rebecca, give me some information on what the Arthritis Foundation is doing right now to communicate and educate folks with arthritis in lieu of most of us dealing with these issues at home.
Yeah, the coronavirus epidemic is really wreaking havoc on our community. And so we actually have a lot of things in place because our population is at high risk. Many of them are elderly or, have underlying conditions. And then there's those of us that are immunocompromised or have suppressed immune systems due to medications, people who are on steroids, things like that to manage their arthritis. So several of the things that we're doing, first of all, we are sending weekly updates to people who have registered for coronavirus and arthritis information specifically. And we have released, we have a podcast called the Live Yes with Arthritis podcast that we have done several episodes related specifically to the coronavirus, including an interview with a leading epidemiologist and rheumatologist. We've done some episodes on how do you stay home ergonomically and protect your joints, working at home, schooling from home, wellness in challenging times, addressing that mental health piece and the increased stress and anxiety people are experiencing right now. We created a resource center on our website called Care and Connect at arthritis.org/cares. And we house a ton of information related to managing your arthritis, the latest updates and information we can provide as it relates to arthritis and coronavirus. But we also have tips and information on staying healthy, what you can do to stay active, things you can do around the home, modifying your environment to protect your joints, how to stay connected and manage your self-care while you're balancing all of these things from home, but also how to stay physically active, and a lot of information as well for families and parenting. Our helpline is another feature that we've always had, but has been quite busy since the coronavirus outbreak. A lot of people are calling in with tons of questions related to access to medication. What do I do about work? How do I protect myself? What if my work doesn't allow me to telework? So a lot of resources for people to help them manage their arthritis, but trying to address the coronavirus specific to the arthritis community's needs.
Sure. I want to go back to one of the earlier comments that you made, Rebecca, and ask Dr. Carson to weigh in a little bit. In the arthritis community, with a lot of the medications and treatments that are out there for these folks, you hear the term immunosuppressed quite often. And I know that both at Pure Infusion Suites and at Oklahoma Arthritis Center, people that have arthritis are on a treatment regimen, and that some of those medications may leave their immune system a bit compromised. So if you could, Dr. Carson, provide us some information on what are the real considerations for someone who is on a medicine that may leave them a bit immunocompromised, and whether or not it's a serious consideration as it relates to coronavirus.
Well, I think the most immune suppressing and dangerous medication are corticosteroids, most commonly prednisone. Unfortunately, many patients with arthritis rely on steroids so they can function on a day-to-day basis, but those are really the most dangerous and most risky medicines that we have for patients with arthritis. Two of my favorite are hydroxychloroquine and sulfasalazine. These are disease-modifying medications that can help with inflammation but do not suppress the immune system. So they've always been a favorite of mine. Now there's interest that maybe hydroxychloroquine might be beneficial in the treatment of coronavirus. I think that remains to be seen, but I'm very comfortable letting patients continue those medications. The other disease modification or disease-modifying drugs we have, like methotrexate and leflunomide and the new tofacitinib and the other JAK inhibitors, I think those are also immune suppressing and increase risk for infection. I think patients and rheumatologists have always liked the biologic medications, especially the infused medications. because they work so well. But it's a good time to point out that the biologics and even the infused biologics, they do increase risk for bacterial infection, but do not increase the risk for viral infections. So I'm very comfortable continuing those medications. And the other interesting note is that for coronavirus pneumonia, some of the infused biologics are now being tested for coronavirus pneumonia. That also makes me feel very comfortable continuing those treatments.
Well, that's great information, Dr. Carson. Thank you very much. One of the things that we hear at the National Infusion Center Association across the country is that there are patients who are delaying treatments, whether it's due to stay-in-place orders, whether it's due to concerns around going into an infusion center, or quite frankly, many of these patients are seeking their treatments in a hospital location. So is this recommendable for those patients to delay those a month, maybe 2 months? And if it isn't, what are the risks for those patients if they do delay?
And I understand the risk and the fears that some patients have in receiving treatments or going to a treatment center that might expose them to the coronavirus. But I think it has to be individualized. If patients are doing well and they're afraid to get out in public and their arthritis is doing well enough that they can miss a treatment and not have a flare-up or an exacerbation of their disease, I think that's fine. But if their disease is just barely controlled anyway and they miss an infusion and their arthritis really flares up, I think that could be worse for them, both in terms of daily functioning, but also you certainly would not want to get coronavirus in the middle of an arthritis flare-up.
Mm-hmm.
So I think the patients and their providers really have to weigh that out.
Yeah. I think, Rebecca, talk to me a little bit more about the Arthritis Foundation. And in particular, one of the things that we've come to learn, obviously with the coronavirus, and whether it's stay in place or some states that are releasing their stay in place, large gatherings are still, I think, going to be something that is probably a year down the road, right? And I know that one of the large initiatives that the Arthritis Foundation has every year is the Arthritis Walk. And I know that at Pure Infusion Suites, with our locations in Utah and in Montana and Idaho and Colorado, that we're heavy participants in the Arthritis Walk. But I think that it coming up in May, it probably is something that many people are rethinking. So tell me a little bit about what the Arthritis Foundation is doing in lieu of the coronavirus world with the Arthritis Walk.
Yeah, it's a sad day when we can't have our actual marquee event of the year across the country. The Walk to Cure Arthritis typically does happen around this time of year in May. May is Arthritis Awareness Month, and it's something my family has always participated in Denver every year for the last 11 years. But due to concerns over the coronavirus and making health and safety a priority for people in our arthritis community, we've canceled all in-person events through the end of May for now, but actually it's extended into the summer. So we've canceled all in-person events, and we're doing a virtual Walk to Cure Arthritis. So one day, same mission. Typically these events across the country have happened, multiple cities on different days. And now it's one day, one event on May 16th. We're doing a virtual Walk to Cure Arthritis. Everybody can go out and walk about their neighborhood with their family and come back and log on to the Arthritis Foundation's Facebook page. We will be having some Facebook Live virtual events at 4 p.m. Eastern Time. And so we're encouraging everybody to continue to fundraise online and do some kind of activity on a 54 campaign is what we're calling it. And so you give 54, you tell 54 of your friends about it, you move maybe for 54 minutes or 54 seconds, and you share what you're doing for your 54 to represent and honor the 54 million people with arthritis.
Mm-hmm. Wow. Well, it's really important because I think that, right now, more than ever, with everyone working from home and a lot of our kiddos having finished school from home, staying connected, and whether it's through calls or webinars or through virtual walks like this is really, really important to know that people aren't alone out there, right? And that there's a way that they can connect and advocate and be involved like something like that. So I think it's really, really great. Dr. Carson, one of the questions that we hear a lot at Pure Infusion Suites and actually at the National Infusion Center Association is a large number of patients that are receiving their treatment regimen for arthritis are receiving these treatments in hospital settings. And one of the challenges, and I think we all, anybody who's receiving some form of care at a hospital that's not coronavirus related, is really worried right now about going into a hospital setting because, as we know, hospitals are, in many areas of the country, are overrun, and they're solely focused in doing whatever they can for the population, to subside the coronavirus. So what have you considered as far as patients or communications that you've had with patients that may have to go or have been going into the hospital as far as finding an alternative site for them to continue their care?
I think that's a really important question. And I think if nothing else, this coronavirus is going to help us really rethink what is the purpose and mission of hospitals in our communities. Is it to provide elective outpatient care, or is it to support the communities when there are problems like the coronavirus? And those questions will all be sorted out, I think, in the months and years to come. But I do think we need to pause and really reflect and ask ourselves, what do we want hospitals to do in our lives? And like you say, are there alternate sites of care for other services? I don't think everything really needs to be provided in the hospital. So I understand patients' concerns about going to the hospital and being exposed to coronavirus or other illnesses. I think that is a reality. I do take some comfort in the fact that hospitals, as well as all medical places, go to great lengths to sanitize and provide a clean and sterile environment. But as long as there's other people around, we do run a risk of getting communicable diseases. So there are alternatives. And I think outpatient infusion centers are a great alternative to the hospital. I think it's a much more intimate environment. There's less exposure and I think safer.
Well, I would agree with you there. And I think one of the things that I wanted to call out on this particular piece is the National Infusion Center Association does have an infusion center locator. And really what it is it's a locator for patients who are advocating for themselves, who are receiving treatment of some form. And if they're worried about going into a hospital setting, they can go out and locate a center near them, and they can find out, are they open and running? What hours are they running? They can find out their phone number, what insurances they take. And so really, if there is a consideration, as you mentioned previously, that, maybe their arthritis is barely being managed appropriately, and so skipping a treatment may not be in their near-term future, that they can find and locate an appropriate center very easily through the National Infusion Center Association to locate a facility that is open and running, has all the documented hygiene and sterilization protocols, and that way they can go in and continue to receive their care in a safe way.
I think that's a great service for patients who are concerned or afraid or don't want to receive their treatments in a hospital. I just knowing that there's an alternative, that's a great service. So thank you for providing that.
Rebecca, give me anything else that we haven't covered as it relates to the Arthritis Foundation. I know the Arthritis Foundation obviously is extremely expansive. You've mentioned a few of the things that you've done as it relates to the arthritis walk, or the virtual walk rather, as well as the movement for 54 and some of the other things. what else does the Arthritis Foundation have available for folks, predominantly in the area of if someone is newly diagnosed with arthritis?
That's a great question. You know, one of the things, the most powerful tool we have right now, I think, is our website. There is so much information on there, especially for somebody who's newly diagnosed. I think that I've been in those shoes. And so I know that back then, if I had all of these resources that I could look over in the privacy of my own home and nobody knew that I was looking at it, that I would have accessed those, you know. I think we have great information about healthy living, treatments, just understanding what is arthritis on our website. About all of the different types of arthritis, and we have some more information specific to various diseases like lupus and osteoarthritis, rheumatoid arthritis. But we do have a wealth of information from treatment planning to information on medications. We regularly update our drug guide on there that provides information on the different drugs and what their purposes, the purpose are for those medications. But one of the other things too is ways to stay active and how to take care and take control of your arthritis. So information on how to stay physically active. We have some great programs that have research behind it, like the Walk with Ease program. So when you have arthritis, you have a lot of pain sometimes, and it's difficult to get in exercise, but staying physically active, we know, is important. And the Walk with Ease program is a great program that is self-guided. You can get a book, there's information online, and learn how to take the baby steps you need to do to start a walking regimen. It might be you're sitting in a chair and you're doing some exercises just to build up some strength before you even go on that walk. So that's one great tool. And another thing is the Yes tool that we have. So you go in and you can log on and say, I have an issue with my knee. It would provide information about exercises and things I can do to strengthen the muscles around my knee and adapting those exercises. Tons of videos and slideshows about things that are arthritis friendly and safe, information on protecting your joints. So diet, everybody wants to know about diet and nutrition when it comes to arthritis. We have a ton of information about diet and nutrition, including some recipes that are great anti-inflammatory diet type recipes that are good for your arthritis and managing it. So much information available on there. But one of the other things that we have that I think is almost equally as important is the ability to connect with other people with arthritis. And we have our Live Yes Arthritis Network is what we call it. And once you join, you are part of this community of people with arthritis. We have an online community forum and you can go in and ask questions. Right now, we actually have these areas for discussion forums. And right now we have a hot topic on coronavirus and arthritis. And we have one of our leading epidemiologists and rheumatologists on there. He's been on there since the beginning of March, answering people's questions when he can, related specifically to coronavirus. But there's other threads of information that people can go on, and you don't have to say really who you are. You can just log in and post a question and hear from other people. So that's one thing. But we also have local support groups, which right now with coronavirus and stay at home, we can't get the groups together, but we have already instituted virtual connect groups. Mm-hmm. And it's been great because more people now are having access to it. They might have been limited in mobility or limited in being able to actually drive to these support group events. And now we've got people who are being able to connect, not just locally, but statewide and regionally, in meeting other people like them. And so for me, that is probably one of the best things as somebody who lives with arthritis as well, is just being able to connect with somebody who gets how you feel. So that's such an important piece of what we do at the Arthritis Foundation, is connecting people with others.
I totally agree. I think one of the ancillary benefits to the world that we live in today is we've all been forced to connect with others, whether it's through work, whether it's through healthcare, whether it's socially, through other means than what we've been used to. You know, some folks are really good at connecting online. Others are a little more resistant. And I think in today's day and age, we've all found a way to reconnect out into the community, reconnect into support groups, reconnect with healthcare, and do it through other avenues. Just to quickly close, Dr. Carson, one thing that at the National Infusion Center Association that we hear a lot about, and with some of these states starting to reopen again, is what people should be considering as it relates to their health care if they're planning on going into a doctor's office here, in the next month or two. We've heard some stories from some practices that say, they'll do a pre-screen call or have you sit out in your car and waiting and you'll get a phone call to come in. Talk to me real quickly just about some of the things you've done at the Oklahoma Arthritis Center to ensure that some of the social distancing, patient safety, as it relates to them coming into the office, that optimal care can be provided in a safe way.
I think that is key. How do you provide optimal care in a safe way? And we are all trying. The Center for Disease Control has provided good guidelines, and I think that's a good measure. If you're concerned, you can see what's recommended and see, is your healthcare provider following current recommendations? I always like to go back to a standard, and right now at this time, I think that is a good standard. But I think the standard screening is to call patients before, make sure they're healthy. When they arrive in the clinic, they're screened with questions, temperatures taken. Patients wait in the cars. If they do have to be in the waiting room, we have half the chairs in the waiting room we did before. They're all separated. Patients aren't allowed visitors anymore. Yeah, that's kind of sad to lose a little bit of the human touch, but most patients understand we're trying to keep them safe. And then wearing masks and gloves when we're interacting with each other and we can't maintain that 6 feet apart that the CDC has recommended. I think those are all good practices, and I think they're going to be with us for a while.
Yeah, I absolutely totally
Joshua,
agree. Go ahead, Rebecca.
I want to add, in our Care and Connect Resource Center, under our frequently asked questions, we do have a lot of information like guidance to ask your infusion center patient, a list of things that kind of just what you said, Dr. Carson, for patients to look for at their infusion center. Does it provide this? Are they checking your temperature at the door? Are there less chairs in the waiting room? But guidance on, what you want to look for as far as safety in engaging back. And then even looking at the question of, when is it important for you to go see your doctor versus it's okay to do a telehealth visit, but providing some of that patient education and guidance is another piece of what we have, and trying to help everybody adjust to this new normal. It's, if somebody's well maintained and they're not having flares, then maybe telehealth is a good thing. But if somebody is really having a lot of pain, and there's nothing better, like you said, than having your doctor actually examine your joints, and at what point is it good to make sure you get in to see your doctor? So great information and guidance for patients that way on our site too.
Yeah, I totally agree. I think the new norm as it relates to seeking healthcare, of engaging in whether it's telephonic or via video conference, on an initial basis, expecting a phone call from your provider prior to your visit, asking you some questions to ensure the safety of not just yourself, which is optimal, but also the safety of the staff in the provider's office. Also the safety for the other folks that may be going into that doctor's office and seeking care. And I know at Pure Infusion Suites, we're one of the only providers from an infusion perspective that do provide infusions in a private suite basis. So I think that it's really important for folks who have arthritis to engage the Arthritis Foundation and some of these resources and understand what are the questions you should ask, whether it's your rheumatologist or if it's your infusion provider, to ensure that, okay, they have the sterilization protocols, they're doing the distancing things necessary. If they have an open infusion floor, are they allowing you to sit with the appropriate distance from other patients receiving care? Are they doing the things to call ahead and make sure that when you arrive, you're walking straight back into your exam room or to your private infusion suite? Just because, again, safety for everybody involved in this supply chain for treatments is optimal. And if someone comes in with coronavirus, it's not as though they can't receive care, but we need to make sure that they're safe and they're taken care of, the other patients that are safe that are going into that office or that facility, and that the staff is. Because as we all know, and we've heard in a lot of the media outlets, that when healthcare professionals have compromised themselves and have coronavirus or have the ability to contract something, that decreases the ability for everybody else to seek care. And it's really important. So Rebecca, Dr. Carson, thank you both very, very much for taking some time. And I appreciate all of your responses and everything, all the information that you've provided. And I look forward to hearing more from you in the future. So thank you very much.
Thank you very much, Josh.
Thank you.